Right now, right here in the upstate, patients in nursing homes and other long-term care facilities have been tied up or trapped in their beds. They've been physically restrained.
It's something state and federal regulators have tried to get rid of since the Reagan administration. But South Carolina still restrains your loved ones at 3 times the national average. 7 News anchor Gordon Dill has been investigating. Gordon.
Nationally, less than 1/2% of long-term care patients are physically restrained by their caregivers. Anything from having the rails on the bed that keep them from getting up to actually tying them down. It's supposed to be very, very rare. In South Carolina, rates of use of these restraints is among the very worst in the nation.
This is Charles Fowler before the stroke, an outdoor type who loved fishing, hunting, and Harley Davidson. The stroke slowed him down. It put him in a wheelchair, but that's not what killed him. Charles died because he couldn't breathe.
He, all by himself, don't know if he was calling for us, don't know how he felt. He had to feel so alone. I mean, he just, sorry.
The coroner's report says Charles Fowler died from positional asphyxia. Deborah Cranford says her brother died because he choked to death, strangled by the medical restraints that bound him to his wheelchair.
They think he slid down, from what the old coroner said, and the harness was strangling him the whole time.
State and federal regulators have tried for decades to eliminate the kinds of restraints that Cranford says killed her brother. But long-term care facilities in South Carolina still use them at 3 times the national average. Only one state physically restrains patients more often, and some local facilities rank among the worst in the nation. No place in the upstate restrains a higher percentage of its patients than here at the Ellenberg Nursing Center in Anderson. On average, about 11% of the patients here are restrained each year. That's 10 times the state average, more than 26 times what you'd expect nationwide. And sometimes the numbers are a lot worse than that. Owner Lyndon Ellenberg wouldn't talk to 7 News on camera, but told me on the phone, quote, "We recognize that we need to get it down." He says they're working with experts to reduce the percentage of patients restrained. At Woodruff Manor in Spartanburg County, staff physically restrained more than 11% of patients in the last 3 months of 2016. It's now under new management, taken over by Spartanburg Regional, which tells us the facility has decreased the number of restraints by 70% since the acquisition. And meet Jason Blaylock. Until last month, he worked as a certified nursing assistant at Lake Emery Post-Acute Care.
They would have like a seat belt bolted to the back of the wheelchair, and it'd be wrapped around with an alarm on the back.
Here's why that matters. Sally Beth Todd teaches nursing at Greenville Tech. Her students study those restraints before training at real long-term care facilities.
And it's secure like this.
And she says there's almost never a good time to tie a patient down.
Restraints are a last resort, an absolute last resort. But you have to try all these alternatives before you ever think about restraining somebody.
Under a combination of state regulations and federal law, physical restraints can't be used unless a doctor specifically authorizes it, and that authorization has to be renewed every 24 hours. Staff can't just leave a patient tied to or trapped in a bed without supervision, and a patient's family must be notified. Using them can be illegal and can seriously injure a patient.
They can have fractures, bruises, skin tears on their arms, depending on the restraints.
Jason Blaylock was fired from Lake Emery Post-Acute Care after he says he filed abuse complaints with the state. Listen to how he describes restraints.
How long would somebody be restrained like that?
For hours at a time.
Patients were for hours at a time. You saw patients for hours at a time restrained to their wheelchair?
Yes.
Without a doctor's permission?
To my knowledge, yes.
The director of Lake Emery Post-Acute Care denied Blaylock's claims. Meanwhile, the state agency responsible for protecting these patients is the Department of Health and Environmental Control. Their staff responds to complaints and sends teams for surprise inspections. But over the last 3 years, the agency only investigated the use of physical restraints 7 times. Nobody at DHEC would speak on camera for this story. So Deborah Cranford is taking the Greenville Community Home, where her brother died, and its director to court. She says it's a way to force change. More than anything, Cranford says she's driven to make sure no one else feels the same terrifying moments her brother, Charles Fowler, felt before he died.
How long did he sit there and choke? I mean, how long was he sitting there? Maybe wanting help.
This afternoon, the administrator at Lake Emery Post-Acute Care sent me a statement in which he continues to deny Jason Blaylock's allegations. It says, in part, quote, "We have not received any complaints or concerns from anyone regarding the use of restraints in our facility. In fact, our policies and procedures require staff members to bring concerns like this to our attention so we can properly and promptly investigate and correct any issues that exist." You can read the administrator's entire statement when you try and find this story right now on WSPA.com. Blaylock, meanwhile, now working in a different facility, which he says, Tom, does not restrain patients. The problem, though, is still very widespread throughout South Carolina.
Well, I'm sure families don't like the idea of their loved ones being restrained. No. But, Gordon, did you find that there are times when regulations say restraints would be proper?
With a doctor's permission, every 24 hours, and those would only be in instances where a patient maybe is grabbing at the tubes in the arm or is becoming violent to the staff or to themselves. But even then, the training for nurses is to try and calm down that agitation, to find out why they're agitated. Again, less than 0.5% nationwide, so it's supposed to be extremely rare.
So we have a pending lawsuit here. We'll see if that brings change, indeed. Gordon, thank you.
Yep.